Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
And welcome to Open Your Eyes.
Good morning, right?
I'm Marlene Cuellar.
And I'm April Martinez.
And thank you for joining us this morning.
Good morning, Belize.
Yes.
How are you today?
Yeah, it's Thursday.
It is Thursday. This week went slow. I feel like the week gone so slow. I'm ready for going to work yesterday.
Okay.
Yeah.
Okay. I don't know if I shared the same sentiment, but sometimes that happens. It just zips by.
Yeah.
For some, and others, it's such a drag.
Such a drag. I think I've been anticipating the weekend and just
maybe
wanting it to come so quickly that's why it's gone.
That's probably what it is.
Yeah.
It's like when you're taking a trip, the journey there takes so long.
And then when you come back home, it's so quickly.
Like that.
That's not fair.
All right. But there's a lot buzzing at the moment.
Yes. We might now have new directors in the Ministry of Health.
Yes.
Yeah. It's possible. They say that they've had candidates, but now it's down to Mrs. Musa and Dr. Musa and Dr. Polanco, I believe.
Yes.
Yes. We'll see. I am actually very hopeful that we get people that are qualified and are able to do their jobs. I always have this thing where I don't care what your name is, I just want you to do the job.
Yeah.
I want you to do the work and I want you to do it right. So if they're eligible, they're qualified, and they can do the job, I'm all for it.
Yeah, I think that information coming out from the Ministry of Health, it's been a long time coming because if we go way back into the history of this, there was, of course, a Director of Health Services, Dr. Marvin Manzanero. With the change of administration, there was, for some reason, a move for him to be removed from that post. That got very murky very fast. And of course, the decision was then to split the role. So instead of having one Director of Health Services, you'd have 3 directors, splitting the responsibilities that the DHS currently holds. And I think it includes international health, there is public health, and then there's hospitals as well. So splitting the role into 3, that went to the House, and then there was the process of looking at candidates. So as we heard from Minister Bernard yesterday, they have in fact put forward their recommendations, and because they're a public service, that has to go to the Ministry of Public Service for proper vetting, and it's a new post as well.
Yeah, and they said that they had the vacancy out for quite some time, and we've kind of covered it a little bit on this show where there's a new director and then they step down, and then there's another new director and then they step down. So it seems that the work is quite tedious, and let's just hope that whosoever becomes those new directors, that they're able to handle that task.
Well, we've already been told by Dr. Marvin Manzanero that in fact, unofficially, because the post isn't solidified as yet, it isn't completed, the process, that he did accept the post for the international health. So that's one aspect. Dr. Melissa Diaz-Musa, I know has been at the forefront, especially in the COVID-19 pandemic for some time. What a lot of people don't know, and I think we don't talk about enough, is their history of work. Dr. Diaz has worked in public health for a really long time, and in fact was at the Matron Roberts Clinic at one point in time, and she was managing there as well. Then she went to Central Region, and of course from that post at Central Region, she then took over as acting DHS about a year ago for a bit of time. So her history is one that's long-standing with public service as well. And when it comes to Dr. Polanco also worked in public health for a long time as well. He was then he went on to the Pan American Health Organization, where he worked as the non-communicable disease focal point in PAHO, and so he worked very closely with the Ministry of Health. So going back to the ministry, it's someplace that he would be comfortable. I just say that because I know we kind of just hear names and what we are accustomed to, and I think that the skeptic and the cynics in all of us, because of what we've seen take place in the assignment or appointment of government roles, is that we think it's friend and favor.
Political.
And so when I look at it, I thought to myself, people are going to come out and start saying many things. But I think if you take the time to look at the history and the background of these professionals, you'd understand that they have been working in these particular areas for a long time.
Yeah.
Now, were there better candidates? I don't know. I can't say who else applied.
Yeah, no, well, he did, Minister Bernard did say that they had quite a few applicants.
Yeah.
And it's just down to the wire with these two. Like I said, I personally prefer to see qualification and action, your years of service, how well you can do your job. And, in any job, there's a period of skepticism, but also that period of practice. Months where you see how well you do. See
Probation,
probation period, can do your job, and then if you can, great. If you can't, like the other directors, we find somebody else. You have to understand that when it comes to health, this is not just a task that you give to anybody, right? You're dealing with people's lives, and with the pandemic, we have seen and time again that you have to be prepared, and you have to not just be prepared for now, but for 5-10 years from now.
Yeah, and I think that was definitely an unfortunate situation when you looked at all these changes taking place in the midst of a pandemic. This is the time where the primary focus was health. I understand the economic challenges that were taking place, but they were driven by a health disaster. So that is, the sooner they can get that sorted and look at making plans moving forward, in what this new existence that we're finding ourselves in, where we're still in a pandemic, but not with the same level of fear and hypervigilance that we had for the first 2 years.
I really liked, and you had Dr. Manza on the show yesterday. He said something very important about not going back to the normal that we're used to. We can't go back. There's no way. Our economy can't take it. Our health system can't take it. Our social life can't take going back to the way things were. That 8 to 5 idea of your job and having that fast-paced life no longer exists anymore. You have to be able to work with the time span that you can and generate the income that you are able to afford and you can provide to your employees. Yeah. So you can't go back to pre-pandemic.
Yeah,
there's no way.
I think that's such an interesting point because it's one of the things within the pandemic that many have struggled with. Not everyone is as open to change. Yeah. Not everyone is as adaptable as we would want to be. Even if you want to be adaptable, it's hard to adapt. So I think that one of the things that consistently COVID-19 and the entire pandemic has forced us to do is that recognize that sometimes changes come your way, change will come your way, and in some cases you can't run away from it. And I do agree. I think anybody who is sitting back thinking there'll be a declaration of the end of the pandemic and things go back to what they were in 2019 or early 2020 are fooling themselves. Yeah. Beyond economic fallout, beyond the scars of the pandemic itself, we're looking at a changed society. Yeah, for sure. A society that has been forced to live life in a completely different setting, who were ruled by law on their movements. And even just the level of awareness that we have now about our healthcare system, and so much else about how our country is going, that we are a changed society. The pandemic has changed us.
And I noticed that not just Belize but other countries, we want to go back to this normal. Everybody's saying, oh, we're going back to school from 8 to 3. We're going back to work 8 to 5. We want to have all of these normal regulations again. And let's be honest, your children are already used to the way things are when it comes to their school. And I think for the most part, based on the numbers, it's working. Your employees are already used to working from home. They already know that they can work from home. They already know that they can provide their services from home. I'm trying to understand the logic of wanting that pre-COVID life again. Because
I think it's natural, though.
Yeah, probably. But I also want to remind people out there that our lifestyle and the way things were pre-pandemic was what brought forth that pandemic. So maybe it wasn't working, and we were forced to change our lives and to switch to something else. So going back to that normal doesn't seem possible to me.
Yeah. And we're not there yet.
No.
You know, there is no official end to the pandemic as yet. We'll be having a bit of a conversation about that today from the medical standpoint, what it means when we can say that the pandemic is officially over. I think what we're doing is what many had said a long time ago, learning to live with it. But there are many other variables. But going back to your point, I think with just the changing environment, with school, with work, Belize is unique because of just, you know, the wide disparities that exist in so many different ways. You know, what rural communities have access to, what urban communities have access to, what the higher income families can afford, what the people who we know are more than half of the country are poor can actually be able to provide. And so when I look at things like the debate in the United States, for example, with work from home, is it something that we can say blanketly applies to Belize? I don't think so. You know, there are some jobs, I know us, we never had a work from home session here. We were, you know, I remember coming to work all through the lockdown. That's part of our job. And there are many other jobs that require in-person, you know, your service providers who will greet you and
I mean, there are a lot of things that have had to pause.
Yeah, but my point was that it doesn't mean that there can't be a rethink to change into what a more modern society can handle, but it must be an all-inclusive approach. Using the example of school, you know, there was a reason there was a push to go back to face-to-face, because it wasn't just access to internet or access to tablet, which we know in some communities was challenging. It was also support. Who had support at home? Who had too many additionals as a child? You know, it's very common in Belize. I grew up that way. The older sibling takes care of the younger sibling. And so when you're imagining a first former taking care of 2 primary school level children, helping them at school, feeding them and caring for their needs, where is the time, one, to just be a child, and secondly, to dedicate to school? So I know that the exposure that they've had to digital learning is one that is now something that can be incorporated, but definitely not that we could just go to this format because we survived the past 2 years. We're yet to see, one, the educational loss, and 2, the impact of the lack of socialization. The post-pandemic period, I think, is going to be interesting when we can really say, okay, this is what COVID caused on us, not just financial and physical health, but all the other fallouts.
I definitely agree. I also feel like it won't be a post-pandemic, it'll be something along the lines of a transition, almost, where this is the life that we have, this is the life that has stabled our economy now, this is the life that has stabled our education, our laws, our philosophies, everything, and this is the life that we're leading now. I'm not sure if it's because we're still going to have it. It's going to be like the flu.
Well, I mean, we don't know yet, April. And so I think, you know, I don't speak in definitive terms like that because I don't have the data for it. And I know scientists are still trying to figure it out. But what I do know is this. We know that we still have a large population that needs to be vaccinated. We know that our booster levels are not where they need to be. You know, you have countries talking about a 4th vaccination. We're still trying to get our fully vaccinated or 2-dose people to 3-dose. And that is a critical part. Look at how Omicron came in and did not care about vaccinations in terms of who it would affect. Thankfully, it was a milder version of COVID than we've seen before. So those who were fully vaccinated, they had an extra boost with their vaccination, but it wasn't as much of a scare. And so I think for me, if we sit and say, okay, everything is taken care of because there's no variant, science doesn't work. Viruses don't work like that
way.
So something comes up and has no regard for two vaccines. We are in a tricky spot because that's where the majority of we have a large number left to be vaccinated and a large number left to be boosted. And so, yes, we don't have it rampant in the country, but let's not just sit complacently and say, okay, well, there's no virus out there with 20 cases, because it takes a matter of weeks for new variants to reach us.
I still find it very strange to see people walking around without masks. I'm not 100% used to the new regulations as yet. I still have the habit of walking around with my mask, and I see people still doing it. And it's just to tell you that some people are taking a certain level of caution still, more than others. I know that majority of the population wanted some level of normalcy, but like I mentioned before, that normalcy is going to be different. And like Marlene rightfully mentioned, we're going to have a conversation soon enough today about that. But I still look at the COVID case numbers. I feel some people have forgotten. I feel like some people don't even know what it is anymore. But every time I hear the news come up and they have those numbers, I look at it. Just because it's at like 12 or 13, it doesn't mean anything.
Well, and even more so, if you look at what's happening in the United States or even in Europe, BA2, which is the subvariant of Omicron, they're trying to tell people, listen, you start sneezing, it's spring in the US. Don't automatically assume it's allergies. It may be the subvariant of Omicron. So, we're still having those conversations. So, but like I said, the silver lining of our situation right now is that the new variants so far have been milder. And so it's a couple days out and you're able to bounce back. Most people do, not all, and we always have to remember that. But yeah, I worry that two things. One, that we have to get to the finish line. We're almost there, so let's work on getting people vaccinated and boosted. Help to educate those who have concerns or worry about side effects, legitimate fears that anybody should have, or questions they should have. Give them a space, opportunity to learn and know more about that. But then the other part is we should already be planning for the next pandemic.
Yes, absolutely. And that's something that I think everyone around the world did not see coming. Mother Nature is a very tricky thing, and that's why things like hurricanes and other natural disasters, including viruses and disease, you don't know. We can't predict those, and that's the scary part about it. So when it comes to economy, when it comes to health, when it comes to resources, those are things that I think nobody was prepared for, nowhere around the world, no matter how first world of a country you are. And so now that we know it's possible, now that we know we have the technology, we're in a better state than we were 100 years ago, where we didn't know what to do. We have this. And so if you have access to vaccines, if you have access to boosters, get it. I mean, the side effects of a vaccine or a booster are to me, very straightforward. This is just my opinion. Your body will always react to something that it's never seen before or it never has before. So whether it's a fever or a cold or something after the vaccination, that is a level of normalcy. I
saw a fantastic ad, it was in the US, they talk about how you protect yourself when you step out into the cold. You add layers, it's a little bit cold, you add another layer. It's just a layer of protection. And these are things but what you're saying is critical, and I think that it's a questions that still have to be answered, and I have always from the beginning said dismissing people who are against getting the vaccine or dismissing people who are hesitant is not going to help to convince them. So there has to be an effort to educate them.
Absolutely.
Yeah. All right, but that's a bit of a summary. This is yesterday was the 2-year anniversary. We're continuing an assessment on COVID and where we go from here from the medical and science perspective in the first part of our show. But let's get moving into some motivation to get us started. And or eye opener taken from dailyom.com goes like this. When the world is in chaos, we can still have our own inner peace and maintain a sense of calm in the sea of unrest. People who maintain their sense of calm when things around them are in a state of flux and confusion are always wonderful to be around. We feel calmer just being near them, as if they have activated our own sense of inner peace. From them we learn we can be calm, even when everything around us is in turmoil, because we know that no matter what happens, this inner sense of calm will help us to function well. Often, times of confusion are the times that enable us to find that part of ourselves that knows how to cope and how to be a light to others in the storm. It helps to remember that we don't need to completely understand what's happening right now, nor do we need to be able to predict the future. Most of us want to find our way to being at peace with whatever happens, and we can find this peace inside. Cultivating our inner clarity with meditation, journaling, and reading words that inspire us will lead us to that place inside us that's already there, just waiting. Feels like a deep breath moment should come after that.
It does. I think that we often don't realize that it's a simple level of meditation or a simple breathing or a simple calm can center you a little bit from all of that chaos that's happening in the world. And chaos doesn't necessarily have to mean the big things like the war in Ukraine or, you know, these things, but something chaotic could mean that, hey, you're just having a really, really crappy day and all that can go wrong will go wrong. The first thing you do is spill coffee upon your dress. The next thing you know, you trip over something. None of your documents are working, and that in itself is very chaotic. And if you dwell in that chaos, you won't be able to function as a human being throughout the day. And so sometimes centering yourself, bringing yourself to a level of meditation and just breathing can help to lighten up that little bit of chaos.
Yeah. Don't we all need that sometimes?
I know that sounded like I was making something up, but no, that was truly a thing that happened once.
But it is, you know, I guess for me what immediately comes to mind is this. I think we've talked before in like conversations about the eye opener, how sometimes people around you are so important.
Yeah.
And I talk about very often having people who can lighten a day for me in an instant. And I also have people who I can call who are calm in chaos. And I think that is so critical. And if you learn to develop it for yourself, it's even more important. Because there's nothing worse than facing something chaotic, confusing, unsettling, and then you're met with that very same type of energy.
Yeah.
So it is a wonderful thing to master. And I say master because it comes with practice.
It's a skill. Yeah.
Deep breathing helps. You hear us talk about it all the show. We have guests who come on and talk about meditation. I have learned, tried, true, and tested just a couple minutes of focusing on your breath makes a world of a difference.
Absolutely.
So if that's what you need for today, go ahead and try it. All right, let's find out about our weather now. We have Francisca on the line. Good morning.
Good morning, Marlene and April.
How are you?
I'm doing great. How about you guys?
I'm doing well. I like this nice dry weather.
Uh-oh.
Soon about to change.
I was about to say. Let me just get in here, Francisca. I want to say happy belated World Meteorological Day to you.
Yes.
You know I don't like saying that word. All right, so let's find out. We want to say thank you, though, for the work that you and the Met Office that you do every day in helping to keep us updated and prepared.
Yes.
And on that note, prepare us for today's weather and what lies ahead.
Okay, my dear. So I just got a message from your coworker that you're getting showers.
Is raining
right.
already?
Yes.
Oh,
She said I sent showers on Coney Drive. Okay, but what we are seeing is that cold front is approaching us, and so it's supporting an increase in moisture and instability over the area. So for this morning, we are going to see cloudy spells, and we'll be seeing an increase in shower activity along the coast this morning, especially over the south, not affecting them as yet. And then by this afternoon, we'll see further increases over that area, over inland areas, increase in showers and thunderstorms as the cold front comes further to us. So by tonight, we'll be seeing these showers and thunderstorms across the country.
Okay, all right. So let's talk about the winds that will come along with that.
Okay, sure. So for this morning, we'll be seeing winds out of the east, 10 to 20 knots, and producing moderate seas. That's 4 to 6 feet waves beyond the reef. By this afternoon, we'll be seeing winds backing up. We say backing up towards the north, northeast, even to the northwest as the front approaches us closer, right?
All right, and our temperatures?
Okay, so I am seeing 86 along the coast this afternoon, 91 inland, 82 up in the Maya Mountains, and then overnight we're seeing 74 along the coast, 70 inland, and 63 up in the Maya Mountains.
Okay. And for the extended forecast, I'm absorbing the fact that we'll get rains because I know the silver lining is that it's because there's a cold front coming.
That's right. That's right. So, I mean, we are seeing that the cold front will cross Belize during the course of today, tonight, and it will be just east of us tomorrow. And with that, the moisture and instability will remain over us. So tomorrow, I'm seeing cloudy skies. I'm seeing a few showers. I'm seeing periods of rain, and we can even get isolated thunderstorms, especially over the sea.
Are we at least going to have some cool, dry weather on the weekend?
Yes, not dry, my dear.
Oh, man.
I am seeing Saturday a little less shower activity, but there will be around.
All right. Well, we appreciate your gentle tempering of my expectations.
You're welcome.
All right. Anything else that we need to know for today?
All right. Well, we have the fire risk forecast. Well, for today, I'm seeing moderate to low fire risk because of this event that's going to happen over us. Already, if you look at the satellite picture, the inland areas that's closer to the border with Guatemala already becoming cloudy.
Okay. All right. Well, we have been warned. Thank you so much for that update for today.
You're welcome, Marlene. And April.
Have a great day.
Okay, then. Bye-bye.
I'm sad now.
All right.
It will pass.
Yeah. With that, though, we got to get moving into our show.
Yes, yes. And our first conversation this morning will be kind of a little bit of an continuing conversation that Marlene and I were having just this morning. In studio, we will have Dr. Jorge Hidalgo, and via Zoom, we'll have Dr. Fernando Cuellar, and then we will just be talking about, you know, why we shouldn't be relaxing just yet with the importance of booster shots, and of course, trying to see to it that everybody gets fully vaccinated in the country.
All right, the second part of the show, the Caribbean Court of Justice, Belize's highest court, is becoming the first court in the region to be accepted into the prestigious International Consortium for Court Excellence. It's a big achievement for us here in the region, and we're actually going to have the president of the CCJ having a conversation with us about how they were able to achieve that and what that means for us moving forward.
Excellent. And then our last segment for today, Marlene, you're a cook?
Why not? Okay. I'll definitely sample, I could say that much.
In studio, we will have Cocina Sabor, and we are going to be probably making fisherman soup with them. So stick around for that segment. I'm excited.
Yeah, all right. So that's what we have in store for you for today. We're going to go ahead and take that break. When we come back, we will be hearing from the medical professionals about COVID moving forward. So please stay tuned.
usuario de eCash, la aplicación eCash está disponible en español. Cambiar el idioma de tu aplicación de eCash de inglés a español es rápido y sencillo. Déjame mostrarte cómo se hace. Primero, abre tu aplicación eCash. Introduce tu PIN. Toca el icono More en la parte inferior de tu pantalla. Selecciona Security. Selecciona Language. Y luego selecciona Spanish. Vuelve a introducir tu PIN y ya está. Tu aplicación de eCash está ahora en español y puedes seguir disfrutando de tu cartera digital eCash. La aplicación eCash de Belize Bank te hace la vida más fácil.
Download the SmartStream app on the Android Play Store and create your account to get access to movies and stream at home or on the go. Prepaid customers can purchase regular data packages or get a discounted rate on a special SmartStream package by dialing 7737. Postpaid customers will be billed monthly. Never miss a movie again with SmartStream.
Applying for a Social Security sickness benefit? Here's what you need to know. A complete claims package include 1. Sickness claim form fully completed by the claimant and medical doctor. 2. Salaries record form completed by the employer or HR representative. 3. Proof of bank account such as bank book, online banking, or statement displaying your name and account number. To submit via email, you need to take a clear photo or scan of the documents and email to claims@socialsecurity.org.bz. Be sure to include your full name, social security number, and benefit type in the subject line of the email. Or you can drop off all completed forms into the Dropbox slot at the nearest branch office. Deadline to submit is 14 days from your first day of illness. All forms are available on the website at www.socialsecurity.org.bz. Social Security Board, safeguarding you, your family, your future.
If you're looking for low-cost television advertising, have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're moving into our first conversation for this morning. As we said, today we take a look at what COVID-19 means for the medical professionals 2 years after our first confirmed cases. And both of you have been on the front line within the private health sector and helping to educate us along the way quite a bit. We have in studio with us Dr. Jorge Hidalgo, who's an internist with the Belize Healthcare Partners Limited. And on Zoom, we have Dr. Fernando Cuellar, internist at the Belize Medical Associates. Good morning.
Good morning, and thank you to having us.
Good morning.
I think so also we need to add that we are 3 intensivists in the country, Dr. Cuellar, Dr. Arriaga, and myself. And I think so that's important
which was the specialist in high demand for treatment of COVID-19 because of how it affected the body. You know, I want to say very quickly, though, because we've been looking at some of the positive spins of what has come from COVID-19. The collaboration between private and public health institutions was definitely one in the pandemic that we saw that was really, even amongst yourselves as fellow internists, how you consulted on cases. Yeah. So
Yeah,
that continues today?
Yes.
Marlene, that's a good segue. You know, that was very important. We three, the three musketeers, the trios, we became very closer friends personally and closer professionals, colleagues working together out at the different institutions. Especially in 2020, we work along with the public sector to help develop the protocols and that kind of thing as best as we could, no? So and that is something that we need to speak about big time, what we've learned. No? I think that's the best thing we can talk about, what our experience with the COVID, what we've learned, what to analyze it, to do analysis, a post-mortem of it, and see what worked, what didn't work, and learn from it for the next one. That's the biggest takeaway I think I can want to leave the country at now.
I really appreciate that you said now we will know how to deal with the next one, because then it tells me that we're already preparing for something like this to happen.
Either the next variant of the SARS or one totally next virus.
Yeah.
And I think we can walk and chew gum. Of course, COVID is a big thing, but there's a lot of non-COVID issues with our healthcare system that needs to be improved. And we can do the both things. We can fix the non-COVID things or improve on the non-COVID things and prepare for the next pandemic. And I think we have the human resources to do that, no?
Yeah.
For example, the guest, the main Banza that was on he has a lot of institutional memory, some good, some bad, but he can be very instrumental in helping put together a plan for the next one, no?
Let me just start off by asking, what's your reaction to, we interviewed the Minister of Health last week, and he said that come April 1st, most of the restrictions will be lifted. There will be some mask mandates, I think, in indoor spaces. We don't have the details as yet, but how do you feel about the country reaching this phase?
I think so. It's the how we approach that next phase. We need to be really, really careful, no? Because even that, despite that, every one of us want to say the pandemic is off. This is not the case, no. And unfortunately, the way how the pandemic is behaving varies in country to country. Now you see what is happening in Hong Kong, what is happening in New Zealand. There's still a lot of number of cases, probably not a lot of hospitalized cases, but we still see a lot of numbers of that. I mean that we know that countries like UK, like Denmark, they say, okay, they are moving to us a new no-pandemic age, but I think so. We need to be very careful and really in the strategies that we are going to take, and we cannot relax. Because of course Omicron is there, the transmission is very high. We just a week ago knew about the recombine of the Omicron and Delta. And of course that we are not seeing those an increase on severity. I think so the lifted of measures, it needs to be on layers and very, very cautious.
Well, I want to add is that you guys at the beginning were using some good words. We can't run away from that. I think we can relax. It's necessary for us to relax, especially for our mental health, economy, that kind of thing. But we should not be careless. We should not be careless, but we can relax. And I think we can do these two things at the same time. No? Relax, yes, but not be careless.
I want to take you both down memory lane a little bit before COVID, because I have this question in my head about why is it that people don't want to be vaccinated or people don't want to take the booster. How, from a medical standpoint, how did you see the numbers of people getting flu shots yearly, before the pandemic? How were those numbers like? Were people doing that consistently?
Remember that the flu shot is nothing like, it basically came in the last years before the pandemic to be more consistent. It's probably more in countries like the United States, and then that they are basically doing it on a regular basis, and then we start to do it again as well. But of course, right now with COVID, one of the things we definitely need to see and to mention is that during 2020, only with measures, just with simple measures, we almost see a significantly reduction in the number of influenza cases. Just to illustrate what simple things it can basically make a difference, not only with COVID, but with many other conditions.
Let me
I think April asked a good question there. And let me add, we have bragging rights in terms of our immunization system and record in Belize over the past 30 years. We had immunizations up in the 90s with childhood diseases and that kind of thing. So overall, we never have one anti-vax attitude here in Belize. I think what scared people a lot in 2020 was the rapidness, the fastness of how the vaccine was developed. And that caused some mistrust or great mistrust, that we never have nothing, and then in 1 year we had a vaccine. And it was hard to explain to people that it was safe to take. So the rapidness, and I wanted to tell people from then that the next vaccine, you want even take one shorter period of time because technology is improving. So if we have one next virus, we might develop a vaccine in 6 months, in 3 months. And that doesn't mean that it will be unsafe, just that we do things better. We go from iPhone 2 to iPhone 17. Okay? That kind of way. So it's important that we start to tell people that, and as we speak right now, you could perceive one little lull in vaccination. And I think the Ministry of Health should continue with their effort to vaccine and booster people, because it has shown to help. So we shouldn't stop pushing that message. We should do that autopsy and figure out what other marketing strategies we could use or could have used better for different parts of the country, so that we can implement it this time around.
Well, one of the things that I want to add that, to the comment that Dr. Cuellar mentioned is that always people thought or are thinking that probably the vaccines basically developed so fast, but we already have a platform, because remember that enter 2000, we already have 2 or 3 outbreaks of different type of SARS. I mean, during those things, the SARS and also the MERS, the SARS in 2003 and the MERS in 2012, that give us a lot of platform that essentially with the collaboration, I think so if something, as you mentioned, not only with us in Belize, but also globally, if something we need to learn is that collaboration is important, and the fact that the scientific community get together, that basically help us to speed the process of the vaccine development. But it's not something that came like a magic, and in 1 year we have a vaccine. No, we already have a platform to work with.
Let's stay on the vaccination for a moment. I was saying that the last numbers I got with vaccination rates in the country, the booster shots specifically were less than 50,000 persons. You know, in the rest of the world, they're exploring a 4th shot. And I know when there was the Omicron wave in the US, the CDC said 2 shots aren't enough. What are your thoughts on where we are with booster shots at this moment, heading into this next phase of the pandemic?
We are definitely not where we would want to be, Marlene. Yeah, we will hope our numbers were higher. And it's just that false sense of normalcy we're getting into, that we don't need any more of these immunization strategies like the booster. So it's important for all of us to continue pushing that message to get booster. Actually, we even have it in a verb form, no?
Yeah.
I done boosted already. It sounds that way, but we need to still continue pushing it.
Is
I want to quickly add
before
I have to leave. There will be one of these days an official declaration of end of pandemic.
Yes.
But for fancy's sake, we could say how we are getting into the endemic phase, meaning that the virus was always there with diabetes. I could bet you we are still have patients with SARS-CoV in the next 5 years, 7 years. It will be endemic, just like how dengue they're on, and just like how flu they're on, we have SARS-CoV. We are always see patients. It will never stop being around, and around the world.
Yeah.
So it will be endemic. It will be like dengue and malaria.
My question though is when it comes to the booster levels. I mean, if they're saying that 2 shots, that the effectiveness has waned, and that you need that 3rd shot to be protected, are we essentially looking at almost a mostly unvaccinated type society in Belize?
Well, I think so. The booster is really important, and then one of the other things, the waning of the system, either you are vaccinated, either you are infected, and then you have certain level of immunity, and how long that's going to last, and the duration of that is something that, unfortunately, we still don't know. As we still don't know if we will need 1 booster or 2 boosters a year. The most important thing, as probably we always say, is we need to try to let the people know, especially those that have a lot of hesitancy, that vaccination is critical. It is basically, I think so at this stage, we can certainly say that as everything, as we say, have side effects, and also, of course, we've seen some side effects related with the vaccine, but the benefits are definitely more important than those, no?
Yeah.
And I think so, as you say, we will need to see what are our booster number lately, and to continue spreading the message and that.
Doc, I understand that you have to leave. Dr. Koyar, you have an emergency that's come up?
In a little bit, I'll tell you.
Okay.
But we might be looking at the yearly shot, guys.
A yearly shot, yeah.
We might looking at
like the flu
doing
shot.
COVID vaccine every year.
Okay.
So what is your message to people, given the fact that you got people who took the initiative, went out, got the 1st dose and 2nd dose, but now when the 3rd dose comes around, they're just not interested?
Yeah, they're fatigued.
Yeah?
They feel like
So what's your message to patients when they come in and they say, well, I already got 2, I don't want to get a 3rd one? Because that's what we're stuck with in this country right now.
Well, you have to tell them that it's necessary because your defense system has weakened over time. The antibodies, the little soldiers that we have to fight the virus has lessened, and we need to stimulate it again. Remember, we're still learning, so it's not defined whether be 1 or 2 more boosters or that yearly shot, but I suspect be 1 yearly shot for the SARS-CoV, just to have our immune system remember the virus.
What is the difference with what is happening in terms of cases in Belize versus cases outside of the country, in terms of like Europe, where I'm seeing people getting four shots, so 2 boosters, 2 vaccines. In Africa, where here in Belize, it's 2 vaccines, only 1 booster, and that's enough. So what is happening with us here? What is the difference with us versus the rest of these countries?
Well, I think so. We in Belize, definitely we have the luxury to even say, okay, we have this amount of vaccines, and what we do with this amount of vaccines, versus other countries that they are struggling to get vaccines. I mean that the access and the inequity on that distribution is definitely something that's still there. No? And if you see in the world tracking vaccine, and you can, with the technology we can see now, we have 64.2 around the world. We got 1 dose of vaccine, but only 14.4 in the low-income countries that only got 1 dose of the vaccine. I mean that's basically itself tell you what the variability and how the pandemic essentially behaves in different ways. Of course, as I mentioned at the beginning, right here we are seeing kind of relaxation, but countries like Hong Kong, New Zealand, they are struggling right now with increase of cases. Europe also is reporting increase on number of cases. And back to the boost and the vaccine. Now you know that some countries they are not asking you to present a test, but they are requiring for you to present your vaccination card to enter a country.
Yeah.
No?
Yeah. So let me ask you, because I think it's a question that everybody has. We saw the new variant Omicron come around. Unfortunately, it had no regard for 2 vaccinations, but luckily it was not as hard on the body for most people. What's the possibility of another wave? And how do we know whether it's going to be worse than Omicron or lighter than Omicron?
Still Dr. Cuellar there?
Well, I think that answer is a little bit tricky because we don't know, honestly, Marlene.
Mm-hmm.
What we can say is that we should expect variants to keep popping up, especially of the same reason that globally we have a low vaccination booster rate. And that's one of the important things that we need to sell to people, that by vaccination, you lower the risk that the new variants, the more deadly variants, the more lethal variants pop up. That's one of the reasons that vaccination helps so much. But because the whole world not have the vaccination and boostering way it wants to be, we should expect one other variant. And that's why we should put things in place to be prepared, whether it can be lesser than Omicron or harder, we can't say. Remember, we also have people who have acquired immunity through natural illness, which has shown also to be quite helpful, no? So, yes, we should be prepared and we should expect. That's why we say we could relax, but we can't be careless, right? And I would have hoped that we continue at least with the mask mandate in the indoors or something like that, and open the nightclubs and open the economy and blah, blah, blah. But definitely you have to maintain some level of personal responsibility, okay? I heard, oh, and by the way, the show today is nice because we have beauty and brains together, no? John and Gavin kind of spied it sometimes.
Oh, Lord. So yes, we don't know whether or not there's going to be a new variant. We don't know how strong it's going to be. You know, let's use lessons from the past 2 years. What are some of the things that you hope as professionals, and you've been in the intensive care units, both treating people and Dr. Cuellar, you had your stint in the hospital as well. You have seen people fighting for their life, fighting to breathe. What do you hope are some of the lessons from the past 2 years that moving forward with the unknown variable of what may come, what do you hope we'll keep in mind?
Yeah, I just want to add something before we move to that comment is that as we mentioned always when we have this conversation, and is that as nature, the virus is going to evolve. There is no way we are going to stop the evolution of the virus. And as long as we have this high transmission and the virus is still going around, and then the possibilities to have a new variants, in that case new lineage of Omicron, but just a week ago the recombination of, we had a documentation in France and Denmark, the recombination, that means is one part of the Omicron combined with one of the Delta. You know, we have that already. Fortunate, after 1 week, we see that it's not increase in severity, it's not increase in that, but we're still on observation. That means that naturally it will evolve, we will have other variants, but if we stop transmission, we still the mobility, then that lessens the chances to have a new variant, of course, and also to reduce the possibility to have. Again, what we say, we need to build in what we learned in the last couple of years. No, I think so that's important.
And Marlene, to answer your question, as intensivists with Jorgito and Pedro and myself, the biggest message we want to give people is, one, try not to get into the intensive care. That means prevention. That means our resources should be geared towards public health, epidemiology, and try not to get into intensive care. As intensivists and people managing the ICU patients, we've learned, therapeutics have improved, we have antivirals, anticoronals. Importantly, we've learned to ventilate, to use the ventilator better with this specific type of patient, the position, the pronation, using less volumes, blah, blah, blah. All of these technicalities we've learned quite a bit, and we've done well in ventilating and helping the people breathe better. Now we've improved the non-invasive measures, okay, with the high flow oxygens and the BPAP and those kinds of things. So in the ICU setting itself, there have been a lot of gain in managing these patients. But I think the message we want to send to people is try to get into the intensive care.
Just to latch on a little bit about what you both said about being more prepared for future pandemics. What are the numbers looking like for access to resources and getting better equipment and getting more people to work with you, manpower? How is that going?
Well, I think so. That's basically put us back to and talk about a little bit more on the specialization and things. No, I mean that one of the most important questions the people ask, and I remember, and probably you remember asking the question to the Ministry of Health is, how many ventilators we have in the country? So we can have 100 ventilators, but we only have 3 intensivists. And also, of course, there are people that, and one of the things that you mentioned at the beginning is that we have a big collaboration, and we start this the continual educational program that we started in April 2020 and is on until now. And that is one of the things that Dr. Cuellar mentioned, the fact that we still collaborating, and we have more than 222 sessions since then.
So, and that doesn't even count nurses, because that was a huge shortage for us as well. Even if you have someone ventilated, they require around-the-clock care. Go ahead.
Yeah, I think that question that April asked can be better mentioned by the official, answered by the Ministry of Health. But we do need to develop human resources, intensivists, ICU specialists, respiratory therapists, not forget the non-COVID patients. We need to stockpile and PPEs perhaps, stockpile and the pharmaceuticals, and we need to do it so that we don't get 1 million doses of remdesivir and then you expire. But do it smartly, but we do need to prepare. We need the facilities. The big issue we had at the beginning, where to put the COVID unit. We need to have a facility that have how to take care of patients with these contagious diseases, no?
Yeah.
And that brings part of a bigger conversation about another tertiary referral place with proper infrastructure. They had to do a lot of adjustments in the regions, Western Regional, Northern Regional, and that is what needs to be put on paper so that we develop that plan, so that we prepare properly for the next go around, no?
It's interesting. We're still getting questions about when people can get boosted. So let's just recap some of that information. How long after the second dose can you get a booster shot?
For the first dose?
After the second dose.
Okay, it should be 6 months.
6 months, so you can still get it then. And after you've recovered from COVID, how long after should you wait to get boosted?
1 month after you can get it.
1 month after. So we hope we answered some of those questions that were coming in. The talk of where we are right now, and I think, there is a general fatigue. We've been living under very difficult circumstances for 2 years. how do you explain to people that, yes, we will try to resume some of the activities that we used to before, but you have to do your own personal risk assessment on a daily basis. So I have to look at what my risk factors are, and I also have to look at the environments that I'll go in. What's the risk assessment that you use, for example?
Doc?
You start.
Well, the age and the comorbidities you have, no? How your age, the other things like diabetes, hypertension, immunosuppression, if you suffer from lupus or if you have renal failure, obesity. It's not a nice word we like to use, but obesity plays a big role. So I think as a country, we should be more effort and not depend on everything the government. Let us take on that personal responsibility and try to improve our health, generally speaking. No, so that's what you do. That you when the persons come into your office, when there's a one-to-one interaction, one short 1 minute, 2 minute discussion about taking better care of yourself, eating healthier, exercising, identify your risk factors, and use the vaccines and boosters because they do work. It will evolve. It will evolve in terms of what would recommendation will look like next year or next 6 months. Believe me, it will evolve because it's evolving.
Yeah.
And but I would hope, and I am trying to prod my colleagues probably that we need to have one proper sit down, all of us, have the famous word, the autopsy of what has happened.
Yeah.
We heard some things from Manza and the next young lady, Miss Main, about what happened. And we should put it down and see what worked and what didn't work and how we can improve on it. So that with a snap of a finger, we could put things on the go next time, no?
Yeah.
And not they walk around in the dark and
please do, if you get that conversation going, let them have a good public education campaign so people aren't up waiting to figure out if there'll be changes tomorrow. Because that was really difficult for people to. Every other country got a stoplight system, but Belize was waiting to find out what was going to happen.
Every aspect of this needs to be looked at and improve, and not just the medical part. You guys in the media also could have a good input in helping to have campaigns going and alerts out and that kind of thing. No,
I appreciate that you keep saying when we're waiting for the next one. No, I appreciate it because what people are doing now when it comes to relaxation is, okay, we just wait to make this done. We want this finished, and after this done, I can move on with my life. And the reality is that we will be expecting something else.
No carelessness. No carelessness. You saw the past 2 weeks, like they let wild animals out the cage. I mean, a big fight front of civic crowds and gatherings that have gone on.
So that takes me back to just a closing question, because we're running out of time so quickly. You, as a medical professional, I'm sure you make calculated judgments of how much risks you'll take. You started off with chronic conditions. One, identify if you have one of the risk factors, control them, get them under control if you can, whether it's obesity, diabetes, hypertension. What about the where to go and what to do? Are you wearing masks everywhere? Are you going to be at the nightclub this weekend? You know, what's
I think so. We need to be very realistic and very careful. Of course, everybody is tired, but one of the things that definitely the pandemic showed is that we as a human, and not only taking overall, we took this challenge and we did it well. No, despite of everything, we adapt. Of course, it's tired, no, by now. But I think so. I think so. We are now close. Hopefully we can say close to the end, but unfortunately it's not yet. Every 3 months the World Health Organization committee have a meeting. The last meeting was in January. We will have the next meeting is going to be in April. Well, essentially they decide if the pandemic, what is the situation with the pandemic, if it's ending or not. Then they will decide it on April. More likely it's not going to be the case, no. But as you say, we need to act with basically a lot of responsibility, and we need to be very cautious as how we are going, what we are going to do next, and also making sure that the simple things we are basically mentioned is still something that we need to practice. It be improved, that it helps.
Yeah.
I think you had asked this question to Dr. Mansa yesterday, Marlene, but I want to ask it one more time. How do you know when it's over? What is happening around us that will allow the World Health Organization to say it's done? We're done. The era of the pandemic is through.
They will look at the numbers overall, and they look at the distribution overall, huh? Because those are the two, I think, biggest criteria that we look at to decide if they are officially declared end of a pandemic. But that doesn't mean that it will disappear. It will be endemic, and it will be endemic in more countries. And of course, the poorer countries are always the one will take the most lead. So you expect that countries like ourselves will have it with us.
Yes.
So we should put in our cabezas that this one never done. And
So let me ask
again,
a simple
that
yes or no
personal
question.
Responsibility.
Let me ask a simple yes or no question. We see that the BA2 or the Omicron subvariant is starting to have their outbreaks or flare-ups or increased cases in other parts of the world. Do you think we'll see that in Belize? Your best guess?
Yes.
Yes?
Yes.
Okay. Lovely.
Well, there you have it, folks.
All right. So
and then Easter coming up, guys.
Yeah?
Easter coming up.
Yeah.
Gatherings will happen. Nightclubs are open. Maybe you could get one sexier looking mask to use in a nightclub in enclosed areas. I would still recommend people have that in mind. Maybe when they're on a beach where it's more open, they don't have to be using their masks and that kind of thing. But when it comes to enclosed areas, please think about using one mask, no?
Yeah.
Another layer of protection.
Yeah.
One final question. For people that still want to get boosted and vaccinated, where can they get boosted and vaccinated?
I think so. They have many centers of the Ministry of Health open. Central region is always open.
Yeah.
I'm not sure, but I believe in the
Ministry of Health.
But April, one of the biggest bragging rights we have is that we haven't had problem with access to vaccines.
No, we don't. People just don't want to go.
On the contrary, we have programs where we go to the house. People, old people and disabled people, they go to the house and vaccinate them. So that don't matter that we don't have the vaccines.
Right.
It's convincing.
The hesitation that was created, no?
Yeah. All right. Well, thank you for coming in this morning. This was a very quick conversation. Time went quickly. But of course, you have both made yourselves so accessible to help to educate people. And we'll keep keeping people informed about the risk factors for themselves as we continue to move through this phase of the pandemic.
Yes.
Thank you.
Thank you both.
Thank you both.
Thank you.
All right, we're going to go ahead and take a break. When we come back, we'll be talking to a representative of the Caribbean Court of Justice about some new developments there. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Technology is ubiquitous, and it's transforming how, when, and where we work. Fulltech Systems is placing award-winning devices in the hands of information workers, allowing them to work without compromise in a world without wires, to innovate, create, and to maximize productivity anytime, anywhere, satisfying the needs of the desk-centric remote and field worker and every other worker in between. We are providing the industry's best devices to businesses going through the process of digital transformation. Partner with us today to provide the solutions that will allow your employees to work effectively and efficiently to enhance your customers' experience. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
No make no sense at all. No kind of sense. That Belize video when I have that sign up there in China for.
That not in China at all, that in Spanish.
You understand what it said then?
Yeah. It said wear your face mask properly, cover your nose and your mouth.
Will help prevent the spread of COVID to others. Together we could make Belize safe.
Wear your mask properly over your mouth and nose to protect yourself and others. Together we can keep Belize COVID-19 safe.
Staying connected with your loved ones while traveling is even more important during this global pandemic. With Digi, this is even easier and more convenient with our data roaming plans. Postpaid customers have instant access to mobile data when in 41 destinations worldwide. With 3 affordable plans, starting at only $28, it's easy to instantly connect via your favorite digital platform. To purchase your data roaming plan, contact Digi before your travel date. If you are already abroad, you can contact us via email at digihelp@livedigi.com or via WhatsApp at 608-8888. For more information, visit our website at livedigi.com/digicel or visit a Digi store near you. You can roam, stay safe, and stay connected with Digi.
If you're looking for low-cost television advertising, have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
Are back and we're moving into our second conversation for today, where we get to provide you some of the interesting developments with the Caribbean Court of Justice. Of course, the Caribbean Court of Justice in Trinidad and Tobago is the highest court for us here in Belize, and recently they have become the first court in this region to be accepted to the prestigious International Consortium for Court Excellence. And joining us this morning, we have the Honorable Justice Peter Jamadar. Good morning.
Good morning to both of you, and good morning to everyone in Belize.
Well, it's lovely that you're able to join us and be able to explain just what the significance of this recognition is. But before we talk about developments, let's just talk about where the CCJ is today. An idea that was a part of, a very critical part of our integration process in the Caribbean, and quite a few years now in practice. Let's talk about where we are today.
Yeah, so okay, of course, as most of you in Belize, I hope, know, that the CCJ was inaugurated in 2005. At present, it operates as a court, two courts in one, we say. In its original jurisdiction, it deals with any questions or disputes under the revised Treaty of Chaguaramas. And basically, that is dealing with the CSME, that is the CARICOM Single Market and Economy, which is the treaty between CARICOM states. And maybe in Belize, you may remember very recently the quote-unquote brown sugar matter that came to the CCJ. But it came in its original jurisdiction. What some people don't appreciate is that all 12 CARICOM members are part of the court in its original jurisdiction. And so in that sense, it is a truly regional court in its original jurisdiction. Not only states have access, but actually corporations and even individuals have access to the court under the revised Treaty of Chaguaramas. It also operates as the final court of appeal for 4 jurisdictions in the region: Barbados, Belize, Guyana, and Dominica. So that is a little bit of a quick overview as to who or what the CCJ is. The CCJ celebrates its 17th anniversary this year. And if I could say, from maybe an insider's point of view, the court is growing from strength to strength and continues to work to develop its internal structures, systems, policies, to remain a court of excellence and to aspire to greater and greater levels of excellence in service of the region, both in the original jurisdiction and, for example, to the people of Belize in its appellate jurisdiction.
Yes.
Just for layman's terms and for viewers, can you explain to us a little bit more about what the International Consortium for Court Excellence is? What does that mean, and what does that mean for the CCJ?
Yes, well, in about 2007, it was recognized that there was no international benchmark framework for courts achieving standards of excellence. Courts are not, they're very unique. They're not like other government agencies or private corporations and so on. And so the idea was one needs to have a framework that could allow court systems, these unique systems, to achieve sustainable, ever progressing standards of excellence. And so the consortium in 2007 develops a framework. The framework is built around what they call core values, focus areas, and uses it in tools and methods to allow any court system to do self-assessment and to engage in a process of continuous evaluation and improvement in all of its systems. So to explain it maybe in very, very simple terms, the International Consortium for Court Excellence has developed an internationally recognized framework or model that can allow any court or court system globally to achieve, first of all, to assess where it is and to achieve the highest standards of excellence, always intending to be in service of the people and citizens in the jurisdictions where these court systems operate.
Can you, so I understand that the international framework was sent in 2016, I believe. What kind of assessments did the CCJ have to undergo in order to be accepted into the international consortium?
Yeah, so yes, I'm going to answer the question, but I'd like to just take a little step back. From inception, in 2005, the CCJ, as an apex court, the only regional apex court, was committed to excellence. And from the inception, the CCJ has been a leader in the region in having systems, policies, and standards of excellence. In about 2016, under President Sir Dennis Byron, the court decided that this consortium existed and this framework existed. Let's see how what we have been doing would measure up, so to speak, according to these international benchmarks and standards. And that was really why the court embarked on this approach to the ICCE for admission. That process sort of developed momentum under President Saunders, and in the last 2 years, the requirements of the consortium were considered, addressed, and the application made. And the good news, of course, is that this year, the consortium has said that, yes, this system that you have been running since 2005, that we have seen, meets our standards, yes. And therefore we can admit you as a member. In admitting us as a member, we joined, for example, just by way of illustration, the Singapore Supreme Court, highly esteemed globally, the U.S. State Court, and other international courts of great repute. Yeah. So that's a little bit of the journey. But for us, what this means, when I say for us, I mean at the CCJ, what this means is that what we have been doing has been something that meets international standards. So it's sort of a validation of what we've been doing. It's a recognition of what we've been doing. And of course, it's an honor. Yes. It's an honor to be recognized in this way. But I just want to emphasize that this was a path that the CCJ was on from inception, and will continue to be committed to making use of the tools and methods and analytics that the consortium provides.
Yeah. Can I, I think it is always wonderful when we're able to celebrate Caribbean excellence. And that's a part of what this is. This is our regional court. For us in Belize, it is our highest court. Yeah. And being able to have that sense of validation that you were in fact functioning at a level that internationally can be recognized for its excellence is one that can be celebrated across the region. But in this process of meetings, the qualification standards, were there any adjustments that had to be made, weaknesses perhaps that had to be strengthened to get us to this point in 2022?
Oh, yes, certainly. What the consortium and the framework provide is sort of like a toolkit, several metrics for measurement. So it's not just one area. So for example, the court may be doing many things very, very well, but there may be certain areas where there are deficits. What the framework allowed us to see was that there were certain deficits. Yeah. For example, in the area of internal policies and protocols. And so the court has now developed, again, a leader in the region, for example, written protocols, setting performance standards for judgment delivery, for court processes, for each of our departments, so that the framework has allowed us, A, to see what our strengths are, what we were doing good, but as you have asked, also to discover some of the areas of weakness and therefore to address them. Yes. And let me just say that this is not a one-off. The whole idea behind this is that it's a continuous cycle of excellence, if you want to call it that way. You assess and analyze, then you plan, then you implement and you evaluate, and you go all over again and again. So this is a continuous path. Yeah. But the difference that the framework has made for the court is it now allows us to examine all areas of our court system. You know, the thing about court systems is this. we often look at the judges and we think, oh, that's the court. But the truth of the matter is that's the tip of the iceberg. An efficient court system and therefore an inefficient court system actually depends on the entire what department or organization you call judiciary.
Yeah.
And so when all of the parts are working well together, like a well-oiled machinery, you get the outputs that matter. Let me just make this very sort of accessible for your listeners. This is not about fancy systems and so on. Yes, it involves that. It is really about delivery of timely, fair justice for ordinary people of the region. And so, for example, some of the measures that are involved are court user satisfaction, case clearance rates, online case processing. Are there backlogs? How long before matters come on? How long before judgments are delivered? Is there trial date certainty? These are things which ordinary people are concerned about. And so what the framework does is it sort of helps court administrators and chief judges look at their system, identify weaknesses, and address them. And it has helped us do that. And so I can say, I think with confidence, that over the last 2 or 3 years, the court has strengthened its court processes, has put in more robust risk management and review policies. And the end result, I think, is an overall more effective, efficient court system.
And, I'm so glad you gave that breakdown, because that was one of the things that I read in the release that I thought was that people would be able to connect with. Because when you talk about even looking at your electronic filing system, the biggest concern that some people may have in elevating their case to a higher court is what costs are associated. Will I have to travel to Trinidad? How much time is it going to take? And how many hours are going to be logged by my lawyer just going through that process? So in this self-assessment that you did, that was also one of the areas that the CCJ strengthened to ensure that persons across the Caribbean have easier access and a more timely response.
Absolutely. And I can see you've done your research, and that's very helpful. But one of the things is access to justice, and access to justice depends on affordability. I'll give you an example. 5 years before Barbados joined the CCJ, 5 matters went to the Privy Council, the highest court. 5 years after, 20 matters went to the CCJ. So what does that mean right away? That's a 400% increase in access to justice. The point being that because of what you've raised, electronic filing and so on, and also our fee structures, we pay attention because in the region, remember, not all currencies have the same value. And if you look, we've just in 2021, for example, updated our rules of court for both the original jurisdiction and for the appellate jurisdiction. Every 2 years, we are committed to that. One of the things we have updated is the area about fees that are payable, costs then, what you call costs. And in doing that, we bear in mind that, for example, if you tag it to the US dollar simpliciter, the ripple effect in, for example, Guyana or Belize or Dominica or Barbados, it'll all be different. And so we have consulted with local bar associations, etc., to come up with fees that are reasonable within local jurisdictions. That's the kind of attention to detail that we look at because we are a service industry. Judiciaries serve people, access to justice. And if the CCJ does not provide that in the region, then they move from the Privy Council to the CCJ. What's the point? Because, of course, the Privy Council is known for its very high fees. You have to pay in pounds. You have to make deposits. before you can start your matter. Is foreign currency available? In the CCJ, you can pay your costs in the local currency.
Wow.
Yeah.
And I can keep going on. The point is that what the consortium has really done, I think, is to look at us from a sort of objective international benchmark perspective and said to us, given an imprimatur of a stamp of excellence, but it's something that we have been doing from inception.
Yeah. And it also includes the maintenance of these standards moving forward.
Right.
Yeah.
Absolutely.
Yeah.
And that's the cycle of excellence, right? You have to assess, analyze, then you have to plan, execute, and evaluate, and have the systems in. But I'll tell you what the framework does that I have found so good. It allows you not to just look at your strengths, because you have these, remember I told you that there were 11 measures, 10 values, and 7 areas. Yeah. So if you imagine a sort of pie chart, all these are areas that you have to pay attention to, so nothing slips through the cracks.
Yeah, right.
For example, a simple thing. How are we treating our employees? Now, why is that important for the court user in Belize? Well, if you have a system where the people who work in the system are motivated, they are treated fairly, with respect, guess what? They want to perform. You getting your judgment on time doesn't depend only on the judge, right?
Yeah.
It's a whole process.
There's administrative work too, yes.
Well, I would actually say that 80% of what goes into an efficient court system has nothing to do with judges in terms of their core function of hearing and deciding cases. But we give 80% of the attention to the judges.
Yeah.
So what
the framework says is look at the whole system.
So moving forward, what does this award mean for Belize when it comes to our court system?
What I think it means for Belize in terms of the CCJ is that Belizeans can rest assured that your final court has received recognition and acknowledgement as a court of the highest standards of excellence. And that will redound for your benefit, certainly when you come to the CCJ. What it also means, I think, for Belize is in terms of leadership in the region, if we can do it, every court system can do it. Yeah. And I'm not going to ask you, but you will know whether there are delays in your internal system then, before you reach the CCJ. Are there delays? Are there challenges?
Yeah.
If the CCJ can achieve this, if the framework can help the CCJ be a sustainable court of excellence, then I think other courts in the region can have a look.
Yeah.
I am sure that they will benefit.
Well, I think we would definitely love to push our internal court systems in that direction.
Absolutely.
But keeping it on the regional front, do you think, Justice, that this can be an additional incentive or perhaps reinforce the qualifications and standards of excellence that other jurisdictions will move to accepting the CCJ as their final appellate court?
Yes. In the region, there are many forces that play out in whether or not jurisdictions have come on board. I think that, and the way you frame it is so astute. And I think that, yes, that this can incentivize, it can assure other jurisdictions to join the appellate jurisdiction. Remember, all of CARICOM, all 12 jurisdictions are on board in the original jurisdiction and getting the benefit of that excellence.
Yeah.
So it's only in the appellate jurisdiction. I think, yes, to the extent that maybe there are people who wonder, can a regional apex court be a court of excellence? Can it have international standards? Yes. I think this can offer an assurance, as you put it, maybe an incentive. But I think that where the rubber hits the road in coming on board is to look at whether you can get more access to justice. That's what people want.
Yes.
I gave you the statistics from Barbados. Can getting your case heard at the highest level, let me go back a step. Can you imagine in 5 years, only 5 matters went to Barbados's highest court before it joined the CCJ? Now, there is something there that is important. Is it that only 5 people wanted to go?
It's a very complex matter, and if you allow us for a moment, because it has triggered a thought, culturally, I think we have mistrust amongst our own. In a local context, you know, when you talk about local courts, and even amongst ourselves in the Caribbean. And I've always, this is on a personal level, wondered whether or not it is perhaps we feel that we need an external entity to somehow tell us we're right or wrong, but it has excluded many people from accessing the courts. I always remember in our move to accepting the CCJ as our final appellate court, one example being used. When we think of some of the issues that we face, there's a cultural nuance that has to be considered very often. And who better to be able to understand it than people who share cultural similarities? But
just not to cut across you.
Yes, no, go ahead.
We have a concrete example. The Maya case is a wonderful example of something. Not only did the court hear and decide the case, as you may know, that matter comes before the court now, periodically for monitoring.
Yes.
Because this court, as a regional court, understands the pragmatics of, you know, if you make an order and leave it to just government agencies to execute, it will never be executed in the way that it could be.
Because the court gave an order, and in some jurisdictions, that's enough.
Yes.
That's right. Yes. But we have understood that.
Yeah.
Does a foreign court understand what it means to be Garifuna in Belize?
Yeah.
Does it understand that is a culture that honors its language and its rituals and the Belize? Does it understand what the bloodwood tree means to Belize?
Yeah.
Does it understand those things? But if you don't understand those things, how do you understand the spirit of Belize?
Yeah.
How do you apply a constitution of Belize that is supposed to come from the people if you are not a part of the people?
Yeah.
Right.
I think, yeah. Well, see, now we can really go.
No, yeah.
Go ahead, Justice.
But
Sorry.
I take your point on validation, and I want to be careful, you know, but I think you are, again, both of you have been wonderful hosts, because I think we must face truth.
Yes.
Yeah.
And I think external agencies have more credit, not because of their performance or merit, but because they are external.
Yeah.
Yes.
And maybe that is a deep insecurity in our people still. And therefore, to come back to this achievement, maybe this achievement, and you asked the question, maybe this achievement will inspire or assure people that, hold on, your own regional apex court has been recognized by an international consortium of court excellence, highly regarded globally as a court of excellence. And we hope it makes a difference, but I'll tell you, whether it does or doesn't, our commitment is to excellence and to deliver the highest standards of justice to the people of Belize and to this region.
Well, that's a wonderful point to end off on, and we could keep going on that validation point for a while, but we do appreciate you joining us to help us understand the significance of this development for the CCJ, and of course, thank you for being accessible to our audience as well.
Yes.
Yeah.
Thank you very much for hosting the CCJ and for this opportunity. We appreciate it. And let's be confident that it'll make a difference.
Yes.
So to both of you and to your station and to all of your viewers from the CCJ, I wish you all the very best. Have a good day.
Thank you,
Thank you
Justice.
very
Have
much.
a good day.
All right.
Yeah.
And with that, we are going to take our next break. And when we come back, Marlene, will you cook? we are going to be cooking. So stick with us. We'll be right back with Cocina Sabor. Stay tuned.
With eCash, bill payment is extremely convenient, and all utility companies accept eCash payments. What's even better? You get to split bills with your roommates, siblings, or whoever you desire. Simply open your eCash app, go to Bill Pay, tap the respective utility company, enter the information, and pay the bill. Then tap the transaction made. Tap Split the bill. Select Evenly. Send the request to who you are splitting the bill with, and get notified when they pay. Talk about making life easy and avoiding confusion. You can split the bill for restaurants, grocery stores, and for any eCash payment you make. To find your next yummy meal, hair treatment, or chill spot, simply open the app and utilize the geolocation service to see nearby businesses that accept eCash. Geolocation and bill payment make life a whole lot easier.
Lamb's Funeral Service can assist you with a dignified send-off for your dearly departed, offering a complete funeral package which includes cremation, dressing, preparation, and repatriation of remains. Caskets, wreaths, and tombs are uniquely made by us. We provide quality service at the most affordable price. Give us a call or WhatsApp at 626-5732 or 623-2597. During ceremonies, the option of live streaming is available. Lamb's Family Funeral Service. It's not just a business. We are a shoulder for you to lean on.
Download the SmartStream app on the Android Play Store and create your account to get access to movies and stream at home or on the go. Prepaid customers can purchase regular data packages or get a discounted rate on a special SmartStream package by dialing 7737. Postpaid customers will be billed monthly. Never miss a movie again with SmartStream.
Been drinking all night, feeling so high. Better not drive, won't even try.
Been drinking all night, feeling so high. Better not drive, ain't gonna try. Been drinking all night, feeling so high. Better not drive, ain't gonna try. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. People die every day, I'm not going with ya. I'ma find my own way, I'm not going with ya. It's okay, I'll wait. Even good people make mistakes. I don't wanna realize when it's too late. Drinking and driving is never safe. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. Been drinking all night, feeling so high. Better not drive, ain't gonna try. Been drinking all night, feeling so high. Better not drive, ain't gonna try.
Hi, Dad.
Hi, Brian. Please stop running around the house.
Right now, Dad.
Damn it, Brian! I told you stop it! Can't you hear me? Are you deaf? Are you just plain... Time out. Your life is stressful, and it is easy to lose your patience. When you feel this is about to happen, take a time out. Harsh words are verbal violence and can be very harmful. They are not forgotten. Offering alternatives and communicating with your child is the best way to build real respect. I'm sorry, Brian. That just had a rough day at work. Can you do something quiet?
Do you want a job?
That's more like it.
And we are back, and we have moved to our kitchen in the studio. And here with us, we have our representatives from Cocina Sabor. We have Oscar Gutierrez, who is the managing director of Cocina Sabor, and Carolina Buendia, our chef this morning. Thank you all for joining us.
Thank you for inviting us, and it's really our pleasure to be standing here, and a great experience to be shared with the rest of our colleagues and in the culinary industry, no?
So, Cocina Sabor from Orange Walk. And people think Orange Walk, they tend to think very limited types of food, but you come with one of your signature recipes.
Yes, yes. Actually, it's fisherman soup kicked off in 2013 to 14 when we just opened doors. And what had happened is because we were trying to get the menu settled and so forth, seafood was one of the major factors that had to add to the menu. And we had all these fishermen passing through at that time in a very fast way. And when I say that, it's because it was common. Now it's difficult to get these fishermen most of the time to the north now because everything goes to the islands. But we managed to get our kitchen tends to have a little bit of this variety of seafood, octopus, shrimp, we have fish, we have also conch, and whenever we have the opportunity to showcase a little different type of fish, then we're able to use it, and Miss Carol is the one that tends to kick off with it. No?
So why is it called fisherman soup? Is it because you buy from the fisherman or because the fisherman order it?
Well, we buy from the fisherman, and in the north everyone likes soup. And so it's a little hangover soup type of thing that was incorporated into the idea.
Okay.
So now with that, with the creativity of the actual recipe is really unique because it gives you a real burst. It's a dairy base. So, which is different than the others who has always been tomato based or
broth
based and so forth. It does incorporate some level of broth, a level of dairy sauce that we create at the restaurant with Miss Carolina, and as well with
So it'll be more chowdery than soup.
Right.
I like water-based soup.
And since it's from the north, I imagine there's a lot of pepper that goes into it.
Lots of flavor.
Lots of flavor.
And
Good morning, everyone. My name is Carolina Buendia. First of all, I want to thank you for giving me this opportunity to be here, to open your eyes. I have been working for almost 6 years, Cocina Sabor, but I started cooking for 3 years, and I have went to Chetumal to take baking courses, to Belize City, culinary cooking, and online supervisor management as well. And it's very excited for me right now.
I know. She does it all basically. I was going to say, you don't have to be nervous. You know exactly what to do, right?
Yes.
I won't even know if you miss a step. I just know what it tastes like.
Yes. Okay. Now.
So let's get
started. Soup. So what are the ingredients that we have here on the table?
The ingredients is white rice, coconut white rice. We have our seafood, fish, conchs, and shrimps. We have our veggies, which is calabacita, carrots, chocho, zucchini, and
Calabacita.
yes.
What is that?
Pumpkin.
Pumpkin.
All right.
Yes, pumpkin.
And broccoli.
Calabacita.
Okay.
Yes, broccoli and cauliflower.
And of
Okay.
So what do we do first?
First, we will put on the stove. Yes.
There it is.
Okay. Thank you. Yes. Okay. On a small saucepan, you add 8 ounces of water. 8 ounces of water.
Are you giving us all the secrets today?
Not today.
I was like, this is real.
And you let it boil for like 5 minutes.
Okay.
Okay. When it meanwhile it's boiling, let me
I want to tell you what April has been watching since she got here.
Okay.
It's that habanero in front of you.
front. All right.
Do you want to bite it?
I mean, you
bite
put
it raw.
My grandma used to do that.
Yeah.
To get it from the tree, but no, I think that's dangerous. You need to speak today. So apart from fisherman's soup, what else does the menu look like at Cocina Sabor?
Okay, what we have added to the menu, it's quite an intensive menu. We have a flair of local menu, which suffices for 70% of our clientele, which is great, which is local support. The 30%, well, obviously, is a breakdown of the international. We have the expats from the north. We also have the rest of the districts visiting us as well. Our menu itself is consists of international flair, which is some of the combined experience between myself and my wife. We brought over some local flair to it with products being presented in a little more gourmet fashion.
Like shrimp tostones?
Shrimp tostones.
Oh, I'll place my order for that one.
Yes. We also are known for great desserts. We have some amazing cheesecakes, Oreo with pineapple and guava sauce, amaretto strawberry cheesecake, the Kahlua coconut flan.
You could see when she went to baking.
Where is that? Did we bring one of those?
And we also cater to a little variety of special situations and functions there. Kids doing their birthdays. We also have anniversaries that we prepare. So the level of food can vary from international to local, to appetizers, to past hors d'oeuvres, and that's my family. And then that's a special we did for the Thanksgiving with an infused dirty rice, pork loin stuffed with stuffings, creamy mashed potato salad, and then we also have bruschettas and dried cranberries. So
that makes me so happy. My good friend Sean Quillen would say we don't have to adapt other people's culture. For Thanksgiving, you did what is the Norteños special meal.
Right.
Dirty rice and pork.
Right.
But fancier, of course. That looks so gourmet.
I think Carolina thinks the water is done.
Ready?
Yes.
Okay.
So what next?
Now that this water has boiled, you add the seafood, which is fish, conchs, and shrimps. Okay, yes.
And the good part with seafood is that it cooks so fast.
Right, that's why you need to be careful.
Yes.
Oh, okay.
So it doesn't overcook, no?
Yes.
Okay. And
okay,
and let it simmer for let's say 3 minutes.
Okay.
Okay, let it simmer. And when it simmer,
so I saw you cut up some cilantro.
Yes, this is
both the leaves and the stems.
Yes, this goes along with the soup, fisherman soup with the coconut white rice.
There's your habanero.
Yes. Coconut white rice. Okay.
Ooh, so
it just went right in the bowl.
Yes.
Meticulous.
Okay. Now, when that simmer, you will add the blanched veggies.
So you have blanched them already?
Yes,
okay.
already. Blanched veggies. Okay.
And once again, we're going with pumpkin, carrots, cauliflower, broccoli,
chocho.
Chocho.
So it's basically a well-balanced dish.
Yes.
It's very heavy as well because the fact that it is actually different veggies additionally to the seafood with the broth itself, then it becomes very more on a heavy side as opposed to being a light broth. No?
Okay.
And you could have it without the rice?
Yes, you can. You can. We're pretty flexible at the restaurant.
I know, but I know, listen, I know my mestiza roots that like you have to have rice or corn tortilla, otherwise it's not really soup.
No, you can request it in corn tortilla if you like it. Yes.
And tell me about this, because I saw the picture just now.
What
is michelada
it?
mix.
Cocina Sabor has its own michelada mix?
Yes, we started that product with one of the assistants of our head bartender, Mr. Telmo. He's not here today, but we also do amazing cocktails showcased. I think we have 1 or 2 drinks there, but for you to actually go, we invite you in to stop in sometime. Telmo has been our head bartender for quite some time, and he's very passionate about it, and he's very good in what he does, you know. So those are crabo, we have dragon fruit, we have mango, and we have the pina colada. So those are just 4 of the
crabo drinks.
Yeah.
Wow. I know quite a few crabo lovers want to try that. And this is the michelada.
Mixes, let's go with any of the...
This is the secret way you can't throw away.
Well, this one is, that's Jessie there, who's one of our servers. She's been with us for quite some time.
Yeah.
So.
Okay, so can you tell us where Cocina Sabor is located for those of us that don't know Orange Walk?
Cocina Sabor is on the Belize Corozal Road. It's the south part of the town itself. We took over that restaurant. At one point it was called Hacienda Steakhouse. So people might be familiar with the location and so forth. It has a great parking area, and it is a really so strategically located for the people that are passing for businesses or want big trucks to park. Yeah. Like for example, the people that are coming from Spanish Loco, they'd be delivering, they come in and they park there and so forth. So,
So now we add.
Carlina is trying to tell us that she's ready.
Yes. Okay. Now we add a chicken stock, white chicken stock, because it is made from scratch. You can use it in sauces, also in your rice, chicken, and soup, like how we are doing right now. It gives a nice flavor.
So you made your own stock?
Yes.
Okay.
And people might ask why I'm not adding salt or black pepper, but this already have it. So you doesn't need to add
the secret.
No
you see?
salt,
no salt, no pepper, just chicken.
Yes,
because that comes flavored already.
Yes. You let's add 2 tablespoons of the chicken stock.
So today we're looking at fisherman's soup, but what are some of the other signature dishes that you find people gravitate towards?
Well, the north is known for a lot of pork.
Yeah.
So we do a lot of salpicon, which is the concept of the ceviche, same mix, but additionally with a little lean parents. The meat is smoked, so at the end it's chopped together and incorporated with tortilla chips.
Okay, and you let it simmer for a little while, like 2 minutes, and then afterwards we will be adding the creamy dairy fisherman. Why creamy dairy fisherman? Because it has coconut milk, heavy cream, and evaporated milk.
Okay.
Yes.
Fisherman's milk.
Yes, it has.
At the end of the section, I'll say something about that.
It has green tomatoes, jalapenos on it.
Oh, so this is the secret.
Yeah, because you notice we don't get no proportions, right? It's like
the fisherman's milk.
Yes.
Okay. So this is the secret to that creamy.
To this delicious soup. Now let me add the creamy.
Smells good.
Yes,
I wish our viewers could smell this kitchen right now.
So your salpicon, you were saying, you make a delicious salpicon.
We also use pork in general for as a jerk pork and a dish as well. It's a grilled, char grilled. We also do fish, roasted garlic fish. We have the fried whole fish, which goes back to a local with the rice and beans or grilled veggies or mashed potatoes or any other. We can always twist it. So we, our slogan is bringing you a twist of flavors. Okay.
All
So now that you've
Yes,
added the
now-
fisherman's milk,
Yes.
how long do you leave it to simmer?
Just to simmer a little bit, not to boil.
Okay.
While, because if you let it boil, it will curdle. Yes. Yes. Like how some people say that, especially when you cook with coconut milk, if you left it, it will
Curdle.
Yeah, separate. So just out of
That's
your
why that was the last
stove
thing that you
and
added.
It's ready. We will serve it on a soup bowl.
Ooh.
Yes.
Look at how fancy that is. Oh, wow. It
So
smells
yummy.
delicious.
Smells so good, and I'm just
Yes.
watching that big piece
Wow.
of conch.
You know,
You have first dibs on the conch. Go ahead.
I mentioned it so that I could have.
Good. All right. Next time, just say I want
Not
it.
the pork.
Okay, we will
Yes.
add
Garnish.
some garnish, chives around the rim. Yes.
Smells delicious. And that's even with a mask on.
Yes. Yes.
So what are your opening hours? People are thinking that's a perfect location, not just for parking, but if you're heading up north too, if you're going anywhere else.
Right. We're open from 11 through till 10.
Okay.
We close on Tuesdays. That's our days off.
Okay.
So we're open from 11 through 10, and we are also available in the event that someone wants a little. We were doing breakfast before, but because of COVID issues we kind of eased it off. But we still have a sort of a menu that they're all capable of doing as well. You know, so that's a lobster, stuffed lobster.
How do you get it to stand that way?
And this is?
This one is a filet mignon.
Oh, this
roasted corn. This one is basically a cranberry sauce.
Cherry wine.
Cherry wine.
Sauce.
Cherry wine, sorry, okay.
She knows what she makes.
Yes, right.
Yes.
And this one, Carol?
This is our this is Mexican tacos. Right there, we do jerk shrimp tacos. Just ask for it and
you'll make
we
it.
will make it.
All right. So
yes.
So
now
this
we
is a blue
have
margarita. Blueberry margarita.
Blueberry margarita.
Yes.
Okay, I think we've teased our taste
Yes,
buds long
just a
enough.
little
I
bit.
feel like how people feel on TV, right? When you're watching, but they can't taste. It's just right there.
Yes.
Yeah.
But it has been so
Absolutely, yeah.
lovely to have you here. I do have one final question, just talking, everybody is looking at this post-pandemic time. What's it like now to be back in business? People are able to come out, eat at restaurants.
Frankly, it is a blessing because at the end of the day, it was a tough time balancing staff, balancing finances, balancing products. Right now, it's great that we opened because of the price that has changed and affected us so much. It is good that we're open long hours now to kind of offset some of that and balance it off. But it has been a real challenge on the road, and fortunately, we are at that point where we should be able to come back to it.
Oh, all right.
So there you go.
Moment of truth.
And then there's the rice if you'd like to balance it.
Somebody's calling with an order already. Just tell them
just
you're
in case.
otherwise occupied, right?
Yes. Sorry, my apologies. And it has the lime. You can squeeze lime or the habanero or the cilantro or the onion, which gives it a different taste to it.
Right.
So.
Oh, that's really good.
Delicious. Thank you.
I was looking at it and I was looking at the ingredients and I see how very different it is from hudut and sere.
Yes.
Right, and it's really all about the texture.
Right.
This right here is very
Right. And on the description of, to touch base, we were talking earlier about fisherman. It says, the description says, good for the back.
That's why he laughed when I said fisherman.
All right. We're slowly moving from daytime TV to nighttime TV. But it has been lovely to have you here. Thank you so much.
Thank
It
you
is absolutely
very much.
delicious.
Yes.
And this is just one of the recipes that people can have. I joked with you. I said, I don't usually order seafood when I go to Orange Walk, but now I know I can, right? And then you reminded me of the proximity to Sarteneja.
Right.
So yeah, now I'm convinced. But thank you both for coming in, and for the rest of your family for coming in and sharing this lovely recipe people can try eating at home.
Yes.
And most importantly, when they're in the area, to stop by Cocina Sabor and enjoy your delicious food.
Yes, well, we thank you very much for having us on board, and it's a great exposure for us to be here and to let the rest of the country know where we are, and we're willing and ready to serve. No?
Gourmet restaurant.
And to our Orange Wakeños, they're saying, we know them.
A special hello to our staff as well, because without them, we're nothing, right?
Yes, absolutely.
All right.
Thank you.
Thank you
Thank
very
you
much
both.
for inviting.
I will
It's
keep
a pleasure
eating
to be here. Hopefully, be back.
Come back and make the salpicon that Marley.
What was it? A Kalua flan?
Kalua
cheese
flan. Coconut flan, yeah.
You're welcome back anytime with that one.
Amaretto, cheesecake.
And the micheladas
And the micheladas are welcome.
Bring the
yes.
bartender now.
Yes, absolutely. That'd be a good segment for him to get a little exposure. So you let us know.
All right. Well, with that, we're going to take our final break, and when we come back, we'll stick up for our wrap up.
Download the SmartStream app on the Android Play Store and create your account to get access to movies and stream at home or on the go. Prepaid customers can purchase regular data packages or get a discounted rate on a special SmartStream package by dialing 7737. Postpaid customers will be billed monthly. Never miss a movie again with SmartStream.
Hi everyone, my name is Gabriela and my name is Kieran. Today we're going to be learning how to put on makeup.
Connecting people, creating memories, sharing a smile. Next Gen, the ultimate digital experience.
Life just got a lot less complicated with Belize Bank Contactless MasterCard Debit Card. Introducing our Standard Debit and MasterCard Platinum Debit Cards. Now you can make purchases anywhere MasterCard is accepted with one tap, pay and go. Your contactless card never has to leave your hands, especially in these times. And your card is embedded with multiple layers of security. Platinum card holders get to enjoy extra benefits like price protection, purchase protection, trip inconvenience, and luggage protection, just to name a few. Start enjoying a cashless lifestyle today with the Belize Bank.
If you're looking for low-cost television advertising, have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
And we're back.
Just like that.
And we haven't finished this one yet.
No, I know.
But because the commercial break was too short.
I'll finish it after.
Yeah. But some great conversations today. You know, three very different topics. First of all, starting off with the conversation with Dr. Hidalgo and Dr. Cuellar. You know, I get it. Everyone is kind of COVID out. You know,
Yeah.
we're just... but it is important that we're able to just recognize what risks exist and how we can reduce that, because we don't know what lies ahead. And I think it's a great time for, I think Dr. Cuera said, you know, we can relax but still be cautious at the same time.
Don't be careless, is what she said, yeah.
And most importantly, you know, get vaccinated. If you're already vaccinated, get boosted.
Right. And I really enjoyed our second conversation we had.
Yeah.
You know, sometimes people think about the ICG, no,
CCJ.
CCJ as very far away from us, even though it is our highest court in our land. But it kind of shows testimony to the fact that we can do it. We can reach a level of excellence in our region. And I think that that's going to create some new measures for us in Belize and how well we can take care of our system, our judicial system. You know, it's very important.
And let's not forget, too, the Caribbean Court of Justice also has Belizean judges.
Yes.
And so it is such a really important step when we have this type of recognition. It's like one of those things where you already know you have a good product. Unfortunately, or fortunately, there are markers you can use to say, yeah, see, I meet the standard of all these things. And that's what the CCG has done. It has reminded people and also helped them to do a self-assessment to improve services for those who access the court. So it was really a great conversation to have to understand more about how they are growing.
Yes, and of course, well, you don't know my favorite thing that we did today.
Fisherman
soup. I really enjoyed I love to cook. You know that. And so the whole concept of breaking it down recipe by recipe and just seeing what all Cocina
with
Sabor
a few
has
secrets
to
that they would have.
Yeah, they're not tell we.
Yeah.
Even, you know, I noticed we just sit down there and then they prepare quietly everything. They're not to tell we exactly what they go on, but they're gone. But it smells really, really great. It tastes really, really great. And they have a wide variety of gourmet meals, not just, you know, your regular rice and beans, but they spruce it up and make it pretty, which I appreciate.
All right, we want to thank Cocina Sabor for coming in, starting their day early with us here on Open Your Eyes and showcasing a brand new recipe. It's fish season.
It is.
So everybody's fitting in more fish around this time of year, especially with Fridays for Lent and Good
Easter.
Friday coming up and Easter. So you have a new recipe for you to try.
Awesome. Thank you so much for you all being with us this morning when you opened your eyes and you started your morning right with us here.
And remember to tune in tomorrow morning at 6:30 where you take it over for Fun Friday with John.
I know, I'm excited. I don't know what we're doing, but it's always up in the air with us.
And remember to tune in to Open Your Eyes.
So start your morning right.
Until then, keep your eyes, your mind,
and your heart open.
We'll see you soon. Enjoy your day, Belize.
Bye.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.